I'll now call the Grand Erie Board of Health meeting to order. And is just noting member Michelle is virtual. We're expecting member Huffman as well virtually, but don't see her yet. Welcome all those here in attendance. At this point, I'll ask board members to declare any pecuniary interest as well as any actual or perceived conflicts of interest, if they have any to declare. Seeing none, then we'll move on to approval of the agenda. Can I have a motion to approve the agenda? Member Metcalf. Member Sicoli seconds that. Is there any discussion? Seeing none, I'll ask for a motion. All those in favor? Okay, carried. And then seeing there's no delegations here, we'll move on to standing reports. I have a very short report. Last meeting, I skipped the verbal report because we were on a tight timeline. So at this time, I wanted to formally welcome member Tom Michelle here on behalf of Amy Martin, member Amy Martin, who's on a leave of absence. Welcome to the board, member Michelle. And then I also wanted to formally welcome member Greg Martin, the new City of Brantford member to the board. Welcome here as well. And then just for an overview as chair, I've attended the community of practice meeting and joint meetings of Emerge Public Health Units since January. So this is opportunity where the different health units that are undergoing the mergers have an opportunity to share milestones and challenges that they're facing. One thing which is really delightful to hear is that they are thrilled with Grand Erie Public Health. Lots of compliments from the ministry and that are members that are in attendance as to our change management strategy that has been implemented. They are thrilled and they're seeking input and information to help other units that are going through this process. So it's really delightful to see the work of Jason and of Sarah that has really done well here and is also making change and helping other units around our province. And overall, what we're hearing is that Grand Erie Public Health is on track with their milestones. We're doing well that way. Where we have some concerns and that is shared with all the other merging health units too, is the wage harmonization funding and some post-merger funding, but that we're already dialoguing together for ways and opportunities to advocate as a group on those things. And then I wanted to alert everyone that member John Bell, member Thomas Shelley, and myself, along with members of our senior leadership team, are attending the Alpha Conference in June. So we'll be bringing reports back from there. And also correspondence has gone out to coordinate a delegation for the AMO conference as well. So that's in the works and staff is continuing to follow up on that. So that is my report. Any questions or comments on anything? Okay, then can I have a motion to receive that report for information purposes? Member Bell, seconded by member Bodner. All those, any further discussion? Seeing none, I'll call the question. All those in favor? Carried. And we'll move on now to our program reports. And we have that at 6.1, healthy growth and development Annual report, and we'll welcome Nikki Los or Loss for that report. Sorry, I didn't want to mispronounce it. Welcome.
Good morning. Good morning, Madam Chair and members of the board. So I'm here today to report on the Grand Area Public Health Healthy Growth and Development Program, which includes our Healthy Babies, Healthy Children program. So early childhood from pregnancy to infancy through early years, it's the most vital and influential period of our long-term health. So this happens, and it's what happens during this period kind of sets the foundation for long-term health for the rest of the life of that person, and then also the health of the community. So my goal today is to highlight why this work matters, what we've accomplished in 2025 and in early 2026, and where we are headed next. So starting with the Healthy Growth and Development team or program, it's guided by the Ontario Public Health Standards and the Healthy Growth and Development Guideline and funded by our Ministry of Health. Research on adverse childhood experiences, or also known as ACEs, tells us that early exposure to trauma, chronic stress, or instability can affect brain development of infants and children, emotional regulation, school readiness, and long-term physical and mental health. So the good news is that prevention early can help mitigate some of these issues. By focusing on pregnancy, infancy, early childhood, we help to build protective factors against build protective factors like responsive caregiving and secure attachments. During our interactions, we support parents and families during vulnerable periods. We reduce health inequities over time, and we strengthen long-term community resilience. This is a population health preventative approach at its most impactful level. So our HDD program is delivered by public health nurses, family home visitors, and program assistants. And together we support families through their pregnancies, breastfeeding, parenting and child development, mental health promotion, and early identification of developmental concerns. The key program of Healthy Growth and Development is Healthy Babies, Healthy Children. And this is a program that's identified to support, or it works with people's identified with risk, and is supported by and funded by the Ministry of Children, Community, and Social Services. HBHC is free and voluntary. We work with families at highest risk, like I said, in a blended home delivery model with our family home visitors and our public health nurses. And it's designed to improve the overall health and development outcome of challenges before they can grow to become more and have more of an impact. In 2025, across GEPH region, we had around 2,600 live births, and we supported pregnancies of our families through different modalities, depending on the local need of the community. Across the region, families had access to online prenatal. In Norfolk County specifically, prenatal education was provided by a collaborative group, including Norfolk General Hospital, Norfolk Family Health Team, and nurses and dietitians from Grand Area Public Health. And so we formally call ourselves the Norfolk Perinatal and Newborn Care Partners. And we have recently been acknowledged as the recipient of the 2026 Alliance Transformative Change Award, where it recognizes system-level collaboration and innovation, and we'll be receiving this award in June. In Haldimand County, we deliver the exact same curriculum by PHN only through GEPH, and it ensures that consistency no matter where you live, you're getting that same evidence-based curriculum and education. We also continue to deliver the Canada Prenatal Nutrition Program in Brantford and Brant County. And in this program, we support young parents or young pregnant and parenting clients, primarily those under 18. That's our target population. And we do this by reducing barriers through food access and grocery vouchers and transportation. And in 2025, we provided 44 drop-in sessions, which were attended by participants and their support persons. We also have our HGD services embedded in the community. So we do this through our early on centers, libraries, supportive housings, our women's shelters, and then clients and people in the community can also access our services and ask for advice through our family line and speak to a nurse. So these options, despite the vast geographical area of GEPH, these options reduce those barriers, promote early intervention, and help families to receive the support at the right time when they need it and how they need it. Some highlights of 2025 include we supported over 2,600 families with prenatal, postpartum, breastfeeding, parenting, and developmental guidance. 1,222 postpartum families were contacted by a public health nurse. We have an 85.5% completion rate for our in-depth assessments, and that's exceeding the provincial target. And of those in-depth assessments, when they're identified with risk, we have a 100% acceptance rate of our HVHC program. And so that too is surpassing the ministry target. So in addition to our direct service delivery, we do strengthen the broader systems through our ACES Community Coalition. We've organized an internal strategy and have recently branched out to the larger community. So through this community coalition, we have over 30 community partners, and this includes Haldimand, Norfolk, City of Brantford, Six Nations, and Mississaugas of the Credit First Nation. We also branch out into the greater community through the Brant Best Start Network, and recently completed an updated newborn guide, which helps serve the whole community of GEPH, ensuring region-wide information for families and providers. So looking forward, our priorities include continuing the harmonization of our HCD and HVHC services across all of our communities, expanding consistent evidence-based programs and parenting messaging, and this includes exploring digital tools so we can continue to expand our reach, strengthening breastfeeding supports using the identified barrier data that we are receiving, and then finalizing and endorsing a multi-year ACES strategy by the end of 2026. In 2027, our focus will look more at implementing some of these strategies, embedding ACES informed practice into policies, service delivery, and our community partnerships with a strong focus on the evaluation and the sustainability of these projects. So in closing, our Healthy Growth and Development Program and our HVHC represent some of the most effective prevention work that we do here at GEPH. And by investing and working collaboratively and supporting families when it matters most, we are improving outcomes not for just for the individual children or families, but for the community as a whole. So thank you. I'm happy to hear any questions.
Thank you, through you, Madam Chair. Nikki, do we advertise in doctors' offices?
So through you, Madam Chair, yes, we advertise in doctors' offices, different things depending on what the ask is from the doctor's office. So sometimes they have more questions about prenatal. We do have standard brochures that we provide information on.
Thank you.
Yeah.
Thank you. Through you, Madam Chair. Great presentation, Nikki. Some good numbers. So 2,600 births, and I believe we're in contact with 2,600 families. So all our live births I basically had access to or were in contacted by GEPH.
So through you, Madam Chair, to Board Member Metcalf. So yes, and we try to. So 12 of those 2,600, we have reached people that we've seen from like numerous years. So they may not be the new birth, but maybe they've had a birth in the previous year and we've connected with them this year. We don't just work with people that have just had a baby. So obviously that's when we want to connect with them, and especially during the prenatal period, but we do connect unfortunately at a later time, but it's still good because we're connecting at some point. But yeah, so the 2,600 births, I can't confidently say we connect with every single one of them because they may have had a birth earlier in the previous year.
Still good numbers though.
Mm-hmm.
Perfect. Thank you.
Thank you, Madam Chair. Nikki, thank you for the report. You're right at the front end of healthcare. If you get your bit right, it means that in 25, 40, 50, 100 years time, things are going to be better all around. Do we capture everybody that gives birth? The 2,600, does the 2,600 represent every birth in the 4 counties?
So through you, Madam Chair, to Board Member Bell. So ideally, yes, we could capture all 26. That's the goal. It's difficult because there's times where, because our program is voluntary, they don't necessarily have to work with us. So they don't provide consent. So we require consent to work with every single person. So if consent's not provided, we cannot connect with every resident. So every birth that happens here in our community.
Do you have any sense of what the gap is between what we do address and what we could address?
So we're sitting at about 65% that we know for a fact we have connected with. of the postpartum numbers. Again, like I was speaking to board member Metcalf, sometimes we don't capture them in the first 6 months, we get them or after the first 6 weeks. So it doesn't get captured as a postpartum, but we capture them at a later stage, like in an early ID.
What's our working relationship with Lansdowne? You talked about children, you find children that are showing indications of developmental challenges, which is where Lansdowne, I think, comes into the picture.
Yeah,
so a good working relationship.
We do. We've had Lansdowne come to our team meetings and provide education on the resources. There is a wait list, so we can help support that by implementing some of the strategies that they have shared with us. We have a pathway for our developmental screens. So if they meet certain criteria, we have identified some kind of developmental concern. Part of that could be a pathway that directs them to Lansdowne. So part of our program is that systems navigation and creating those warm handovers to help navigate the system and help people to find the resources like Lansdowne.
One final question, and maybe it's more for Jason than you, Nikki, but if you, and you probably know it better than I do, because if you listen to the American media, particularly to the Health and Home Health Secretary, what's his name, RFK, he would indicate that autism is on the rise. Do we have any evidence, Nikki, do we have any evidence from the 2,600 children births that we see that autism is on the rise in our 4 counties?
So no, at this point, I can't confirm that we have a direct relation to autism numbers. What we are seeing is a increase in complexity, but that's not just, related to child behavior or autism. It's multiple layers that increase the complexities in our clients. So I think we can confidently say that there is an increase in complexity, and that's why our work is so important, but I can't confidently say that there's an increase in the autism numbers in our community.
Thank you. Jason, you don't want to comment on that?
Through the chair to Vice Chair Bell. Yeah, I think speaking specifically to RFK Jr., he's trying to insinuate a link between autism and vaccination, which of course is largely debunked. We've talked about that for a long time now in the scientific community. I think there's multiple reasons why certain areas, not just in Canada, the US, there maybe does seem to be increase in diagnosis of autism spectrum disorders, and so there's a multitude of factors for that, probably just better recognition of early symptoms and things like that. So it's a large, complex topic, but certainly specifically to his point about linking autism with vaccination, that's been, of course, largely debunked and not accepted by the scientific community at all.
Thank you.
Metcalf, did you have?
Yeah, just
question?
one more. Through you, Madam Chair. Nikki, do we have mechanisms in place that would identify higher risk, maybe from a socioeconomic situation? Are there anything, do we have mechanisms in place that would identify, families at risk, young mothers at risk of, I wouldn't say at risk, but that would need more help,
So through chair to you, board member, so yes, there is like our screening, our in-depth assessment, it goes through all the social determinants of health. So there's the social determinants of health are vast on their influence on the health of our clients that we work with. So through completing these in-depth assessments, they will help us to identify what the level of risk is based on very in-depth questions. So we are mindful of the different variables that impact the overall health, not just the physical health or mental health, but like the other factors around food insecurity, housing, education. When we're providing care, our care and support for these families is very comprehensive. It's not targeted on one thing.
Member Michelle, did you have any questions?
No, I don't. Thank you, Madam Chair. I do appreciate the comment about the Norfolk prenatal team. I think that's great news, and I'm happy with that progress. Thank you.
Thank you. Any further questions? Hey, thank you very much for your presentation, Nikki. Really appreciate that.
Thanks, Nikki.
So then, could I have a motion to receive that report for information purposes? Thank you, Member Sokol. Member Bell, thank you. All those in favor? And that's carried. And we'll now move on to 6.2 Environmental Health Report, and we welcome Alexis Atkinson and Keith Corey forward. Good morning, and just proceed when you're ready.
Through you, Madam Chair, good morning, everyone. Alexis and I will provide some highlights from our board report. This report included in the board package provides a comprehensive overview of the environmental health and tobacco enforcement programs at Grand Erie Public Health. For some additional background, under Section 5 of the Health Protection and Promotion Act, boards of health are mandated to provide the public health programs in accordance with the Ontario Public Health Standards. Environmental health fulfills this mandate by preventing and managing health hazards through a number of core programs, such as health hazards, safe water, food safety, vector-borne and rabies prevention, and tobacco enforcement under the Smoke-Free Ontario Act.
The environmental health team at GEPH consists of 15 public health inspectors, 1 senior public health inspector, 3 program assistants, 4 tobacco enforcement officers, and 3 student test shoppers. A few program highlights of activities for 2025 include, under the Safe Water Program, we conducted 155 small drinking water system inspections and responded to 111 adverse water quality incident responses as well. This is an increase from 75 inspections in 2024. AWQI response remains stable during this time. 238 recreational water inspections across pools, spas, splash pads, and beaches were also conducted.
And then under our Safe Food Program, we conducted a total of 3,340 inspections of food premises. We also provided food handler training to 786 clients and responded to 259 complaints and foodborne illness investigations. And this is an increase from 217 in 2024. In keeping with our progressive enforcement approach, inspectors issued a total of 24 Section 13 orders and 4 tickets. This is an increase from 11 Section 13 orders and 3 tickets in 2024. And just for some additional background, Section 13 orders are issued by public health inspectors when health hazards are identified that cannot be eliminated during the inspection. And these can include items such as no hot water on site during the inspection. Under the Rabies Prevention and Control Program, we investigated 1,385 potential rabies exposures. This is also an increase from 1,174 in 2024. Additionally, we submitted 87 animals for rabies testing, and this is also an increase from 60 in 2024. In 2025, bats and cats accounted for the majority of animals submitted. We also dispensed rabies post-exposure prophylaxis for 305 individuals, and this is an increase from 156 in 2024. We believe this is heavily driven by the rabies daycare exposure in August of 2025. And finally, regarding public health education in the rabies program, public health education and outreach efforts continue to be our priority through social media and through communication with our community partners, including healthcare providers and hospitals.
Under the Health Hazards Program, we conducted 772 seasonal housing inspections. We also responded to 106 complaint responses. We also issued 19 extreme weather advisories. Under the Tobacco Enforcement Program, we conducted 715 tobacco and vapor product retailer inspections for display and promotion requirements, which is an increase from 570 in 2024. 463 test shops for compliance with age restrictions, which was an increase from 359 in 2024. And we investigated 51 complaints related to tobacco and vapor product requirements under the Smoke-Free Ontario Act, which is also an increase from 19 in 2024.
And we did want to highlight some environmental health harmonization activities. Our 24/7 on-call emergency response system has transitioned to a model consisting of one manager and two public health inspectors, ensuring a consistent approach and a single point of contact at the management level. We've completed several harmonization activities, including user fee alignment, extreme weather response, food handler training, as well as Smoke-Free Ontario Act forms and tobacco and vapor test shopping processes. We also have several harmonization activities in progress, and these include disclosure, food safety, drinking water and rec water, rabies, as well as hedgehog inspection and investigation processes, and the environmental health service delivery model. 4 student public health inspector practicum positions have been filled, and these candidates are due to start on May the 4th. And additionally, recruitment is currently underway to hire 3 temporary public health inspectors to fill a vacancy and support ongoing harmonization efforts. And then just in closing, we do appreciate the opportunity to present this report to you today and are happy to respond to any questions.
Thank you. Are there any questions? Member Bodnar?
Thank you through you, Madam Chair. That's a good report. Thank you. For Mary Brown's Chicken, when's that going to hit the media?
It's there.
It's there.
I didn't see it first thing this morning in this plaza.
Through you, Madam Chair, yes, I believe
Okay,
that
it
that
is there,
is
right? Okay.
through the media.
And
So
so
we
you
did
pulled
respond.
and so you put a big notice on their front door then?
Yeah, that is a standard operating procedure. It's called like a placard. So whenever there is a health hazard identified that cannot be mitigated at the time of that inspection, the inspector does verbally order and then back it up with a written order and then post the placard on site to alert the public.
And will you be notifying CHCH PD as well? Because I noticed they did a little verb on the Piper Arms in Stony Creek. I'm just wondering, am I going to see that on the news tonight too?
Through you, Madam Chair, I'm actually not sure about that. I mean, that's possible.
Yeah, it's good to advertise that people aren't following the rules, so.
Yeah.
You have to hit them in the pocketbook, otherwise they don't win. Thank you, Madam Chair.
Any other? Member Bell?
Yeah, thank you for the report. I really enjoyed reading it. The safe water always catches my eye. Can you define what a small drinking water system is and give some examples?
Yes, so it's a non-municipal water system. So those would be potentially businesses that are on a cistern or a well. And so they're private systems, not municipal systems.
So how do we define what's on our list of small drinking water systems? I'll give you an example. My daughter-in-law lives in Burford. She has a well. It's a small drinking water system. I doubt she's on your list.
That is a private water system. So we do respond to private water system inquiries from the public. People are able to submit water sampling through us to the lab in Toronto and receive their results. If we do not see the private system water results for personal homes, however, if somebody sees the results and there's an adverse result, they can call us, which they do, and we help mitigate their issues within their small drinking personal water system.
So it's a bit of a hobby horse of mine, as some of you know. And it's been, when we were Brant County Health Unit, the majority of wells on private property were in the county. Now we got Holden and the Norfolk, we've probably tripled them, if not gone beyond that. So I think it's an area of potential concern for me. And I know that in Brant County, people do not test their wells as often as they should. I would like us to elevate the focus on that if it's possible. I know we talk about you can come and get your wells tested or get your water tested, but can we start to collect some data as to how good our wells are in terms of the water quality and start to really promote it on the basis of this is what we're seeing. It's not good enough, or you're at risk.
Through the chair to Member Bell. It is difficult to know exactly in terms of the private well water, what the results are because we don't necessarily see them unless we get an inquiry. But I can tell you that we have close to 300 small drinking water systems that we do monitor, which has been elevated for Brant County Health Unit as a result of Haldimand and Norfolk counties rural landscape being added to that. So there is quite a number. We try to do our very, very best in terms of monitoring as well with the private water systems, but it is often difficult to get those results unless we're directly contacted.
Is there a privacy issue there? Through Madam Chair, is there a privacy issue?
I don't know if there is necessarily a privacy issue, but those results go directly to the client because it is private. So we don't get shared that information unless we are contacted by the client themselves. Do you have anything to add?
And yes, through the chair, maybe just to add, there are a number of activities that we do to try to promote private well water. We certainly do post social media. We have good content on our website. We do promote well water at our special events in the community. We've partnered with the County of Brant and the municipal office to have a satellite pickup and drop off location there. And under the Safe Drinking Water Protocol, it does outline some of the main responsibilities of public health units. And in particular, it does outline that we make those materials available, we educate the public, and if we do receive requests for interpretation or public health guidance, we provide that upon request.
It just seems like it's an interesting gap because as a municipal councillor, as all municipal councillors are, we're responsible personally for the quality of municipal supplied water. And the next step is the health unit takes the same role for these small drinking water systems. We cover the next piece of the puzzle, but the final piece of the puzzle we don't have any involvement in directly. And it seems to be an area of weakness because it actually affects, probably in our community, I'm going to guess 150,000 people, because there aren't that many parts of the 4 counties that are on municipal water. Certainly half the county isn't, more than half the county is. I suspect in Haldimand and Norfolk, it's probably something similar in that vein. So there's a huge area of threat in my mind. And I'm saddened to hear we don't actually get the results and don't understand what is happening because individuals may not actually take the right course of action. So I'd like to promote it as best I can.
Yeah.
Absolutely. And just something else to add, one amazing opportunity that we have the ability to do is to reach people at a younger age. We are going to be attending the Amazing Aquifer event for grade 3 students. And it is very, very important for us to be able to educate young people so that they carry that information for the rest of their life.
One final question. I don't ask it, somebody else will. Hedgehog. The harmonization activities include aligning hedgehog versions. So have we got different versions of hedgehogs in the counties?
Through the chair, I can take that question. And thank you, Member Bell. So Hedgehog obviously is our main inspection software and investigation software. It's actually used across the province quite extensively. Prior to the merger, we were operating on different versions of the same software. And as part of our harmonization activities, we then harmonized our version. And then we are progressing towards harmonizing the database so that we'll share one database.
Okay, so the hedgehog communities of the 4 counties can rest easily.
Correct.
Member Martin?
Yeah, thank you. If all the water testing goes through you to the lab, I understand that you don't get individual results for privacy reasons, but can you ask the lab to do an aggregate and give you like every 3 months or whatever, this number failed, this number we're good, just so we have an idea of what the water quality is in the wells in the area?
Through you, the chair, we do have access to private well water through a public health Ontario SharePoint site, and we can pull some data through that site. But as I mentioned, the requirements under the protocol, do require us to respond upon request. But for surveillance purposes, we can go on to that website and pull data off of that website. But it's not our data. It is Public Health Ontario's data.
But you can pull our region from that. Okay.
That's correct. Yeah.
Any other questions from members? Go ahead.
I'll just add, through the chair. Thank you guys so much for the great presentation. Just wanted to add a really quick piece on rabies because we're coming into spring and summer, of course. And so our biggest message to the public by far is to really avoid any contact with wild animals. So you are at risk for rabies when you have direct contact through a bite of an infected animal. So if you're not in direct contact with them or have risk of a bite, then you are not exposed to rabies. And so it's that is our hugest message. We have, last summer was extremely busy for this team and others with regards to a lot of contact with bats in particular, which we know have rabies, and we're not going to be able to change that. We have bats in our community that do have rabies. So the biggest way to stay safe is just to avoid direct contact. Do not try to remove the bat from your home yourself, and just try to avoid all contact. Contact the appropriate animal authorities for that. If you can avoid direct contact, you are not at risk for rabies. So of course there are situations in which you can't avoid it. And so those people we absolutely encourage to get medical attention and get post-exposure prophylaxis if it is indicated. But a big, it's very cumbersome on the healthcare system, on us. It's also very cumbersome on the individual because of the regimen required for post-exposure prophylaxis. So, our biggest message coming into the summer is to really just encouraging everyone to avoid direct contact with wild animals, in particular bats, and contact the appropriate animal authorities to remove them from your home.
Okay, thank you for that. And then with tick season coming up, is there messaging going up about that? Because I'm starting to notice those are crawling out of their hiding spots too.
To the chair, yes, so we've been promoting social media, and as you know, last year we had a novel disease that appeared in Norfolk County, which was Rocky Mountain spotted fever. So we have been promoting education regarding Rocky Mountain spotted fever, as well as Lyme disease, and we start our tick dragging activities shortly this month.
Thank you. Thank you very much for that report. Alexis and Keith, really appreciated your time and energy in that. And could I have a motion now to receive the report for information purposes? Member Martin, seconder, member Metcalf. Oh, Michelle. Correct. All those in favor? Once again, thank you very much for your time.
Thank you.
And we'll move on to committee reports and recommendations. There is no report for the Finance and Audit Committee, so we'll move on to 7.2 Governance Committee Land Acknowledgement. And Nicole, I'll let you take over from here.
Or
You wanna speak to it?
go briefly and then
absolutely.
there's more to it. So the governance committee met as per directed by the board to review our land acknowledgement, and we considered some feedback from our First Nations partners, and we put together what we hope will be an acceptable land acknowledgement moving forward for the board's consideration. We have not to date heard back from Six Nations of the Grand River, but we did get feedback from the Mississaugas of the Credit First Nations. So the document that we are presenting today is what we call a living document, which means we can alter it as needed as we receive feedback, as the landscape changes, and we need to reconsider what we're acknowledging at the beginning of our meeting. So we present here for feedback from this board for consideration. Anything else we should? All right.
Thank you for that, Member Sakoli. Any questions? Member Martin?
More a comment. I don't believe in land acknowledgement. I think it's virtue signaling. I don't think it really means much of anything. And there's no reciprocal acknowledgement. Like, what about my treaty rights? They do nothing to acknowledge that some of the land was sold, some of the land was traded for services. They just say everything's under claim. So it has to be a two-way street, and I don't see that that's happening right now. So I don't believe in doing land acknowledgements, and I won't be supporting this.
Okay, thank you. Any further comments? Member Martin?
Madam Chair, Rose, do we need the okay from the other Indigenous nations as well? As the Mississaugas, do we need the other ones to have input before we?
So
You want me to? So, on that, actually, the AMO has set out some practice directions on
Okay.
putting these forward. And they recommend reaching out and seeking input, but not to delay using them. If you're not receiving that, and just acknowledge it as a living document that may need to change from time to time as circumstances change. So that's the best practices now from the AMO that's coming out on these type of
That's
things.
fine. And just another question, do we need, does it have to be, I know Rose is recommending that the governance committee do it in this direct fashion, but just as a comment.
just as a point of order, Rose isn't recommending anything.
Sorry, okay.
The governance.
Governance
Committee,
committee, okay.
which I am the
All
chair
right,
of.
thank you for bringing that. Okay, so just as a comment, if I may, on other committees I serve, they don't actually do it this way. They just have a historical context. They talk about historical context of our relationships with with Canada's Indigenous communities. But obviously the government's committee is recommending this format then. So we stick with this rather than
Yes.
a hybrid form. Okay. Thank you. Excellent.
Any further comments?
Can I also note through the chair that it was recommended at the governance committee meeting that for shared ownership that we circle through the reading of the land acknowledgement through the members. So I will give you a heads up if there's objection, we can deal with it at that time. And we will just go through it alphabetically. So it will start in May, and Member Bell will commence, and he will begin the reading at the start of the meeting there.
And so any further questions? Seeing none, then may I please have a mover and a seconder for the motion to adopt the land acknowledgement. Member Rose, seconded by Member Bell. All those in favor? That is carried. And now moving on to consent agenda items. Are there any items that anyone would like to remove from the consent agenda for discussion? Member Bell?
8-7.
Okay. And so. And then, so with the removal of 8-7, which we can speak to shortly, Can we have a motion to receive the remainder for information? Member Martin, seconded by Member Sikoli. All those in favor? Carried. And then, Member Bell, did you want to address 8.7?
I will. I got a call late last year from the Alpha secretary saying they needed somebody to fill a space on the board of directors to represent this board of, or this area on the board of health subcommittee, which is also put you on the board of directors. Hopefully, my appointment only runs till June of this year, so they need a replacement. Even if I run for election, I'm not sure I will, but if I do and I'm successful, I will not come back to the Board of Health next time around. I will have done 8 years then. I think it's time to let somebody else have the pleasure of working with you folks. But I would suggest that if somebody is planning to run for election, has confidence, or is a provincial nominee, to consider joining the board of directors. It does clue you into what's going on the wider activities of Alpha. So I think Nicole has the opportunity to submit a nomination on our behalf. So if anybody wants to do that, then I would suggest they contact Nicole and she can move it forward.
Any questions from anyone on that?
Through yourself as the chair, we do have to have support of the full board in order to put a name forward. So we would need a resolution of support to support a member should they want to put their name forward. And it is due on the 17th. And they have to be able to attend a meeting on May 5th virtually to vote. So there's a few different caveats there, but I welcome any nominations and can address that accordingly.
Madam Chair, I nominate for chair. Seeking a seconder.
Panic, no.
Not right now. Maybe
Counselor
in-
Bell's not coming back. I'm not coming back.
Hey, let me get chair under my belt for a year or so.
Now, there are other health units that can
Yeah,
nominate in our region. So
yeah.
if we don't do it, it's not the end of the world.
Exactly. So then, I'll ask for a motion just to receive, Member Bell's information for information purposes on 8.7. Member Sikoli, seconded by Metcalf. All those in favor? Carry. We're moving on now to notices of motion. Does any member wish to give a notice of motion?
Not so much a notice of motion, but something to have on the next agenda, if that's possible. There has been some press information about a dentist who the health unit found to be wanting in terms of his some of his practices. Jason has been mentioned in those reports. I think if we could get an update at our next meeting, that would be very helpful.
Do we need to motion for that or just?
Can just note that there were no notices of motion and we can have that under upcoming agenda items as a
Okay.
recommended item. We don't need a motion.
So then, any other formal?
I don't know if this is considered a motion or not, but in February of last year, I was appointed as the rep for the Brantford Grant Alderman Norfolk Ontario Health Team. And I don't know how long that appointment is supposed to be. So I'm willing to stay on, but if someone else wants to take over, that's fine too. So I don't know how the new board handles that.
Okay.
So just it's not really a motion, it's
It's
just.
just for information purposes.
So okay, thank you.
Thank you for that. Is there anything we need to do from our end to investigate that, Member Bodnar, or they will provide you with information on that?
No, they just, they have no input on that. They just. Well, no, I'm just mentioning, I don't, someone else would like to volunteer, that's fine too. I know, I'm just asking what the terms are. That's-
Okay.
Thank you.
Is that something we can determine and figure out from our end?
I can put a report on the next agenda to address it and ask for any, and can provide some context and information, background information, and contact them as well to see if they have any feedback on their links.
That would be great. Thank you.
Thank you.
Member Metcalf.
Yeah, not really a notice of motion, but just in our agenda structure, as Member Bell, Member Bodnar had concerns or things they wanted to bring up. So can we add a line in the agenda, maybe new business or announcements, concerns, new business? And then that way it doesn't have to formally be a notice of motion, but there was a concern about a dentist, there was concern about, sitting on different boards and committees and things like that. So I don't know if that would have to go through the governance committee to be adopted as part of our agenda structure, but
And I think that's the purpose of this notice of motion, upcoming agenda items on it, so that we can canvass those. So we're doing it right at the appropriate time. So if you have those things, then I would recommend we bring them up just like we're bringing them up here. And then we can determine whether it's a formal notice or if it's just coming up under number 10, that we will deal with it through that.
okay.
Thank you for that, Member Metcalf. Any further items? Seeing none, we'll move on to upcoming agenda items. So I will not be here at the next Board of Health. So Vice Chair Bell will assume the duties of chair for the next meeting. If there's anything urgent, please contact Member Bell or Nicole if you require assistance. I am away from May 10 until May 22nd. So
Hopefully somewhere hot.
I'm in the Netherlands. I'm doing
Cool.
family reunion, all kinds of stuff. So yeah, looking forward to. So, and then the board is holding a special, or we have the following items now on the May 20 meeting. We'll have information on the things that were brought up by Member Bodnar. We'll have the program and the report regarding the dentist. And then we'll have program reports on infectious disease and a special presentation for Planet Youth Project update. And I'm sorry to miss that one. So that'll be nice to hear about that as well. That's exciting. So that'll probably be a longer report, not a 10-minute report, right?
Yeah, about 15 minutes and then at least 5 or 10 minutes for Q&A. Yeah.
Okay, perfect. And then we have the Board of Health holding a special meeting Friday, June 12th. That's for the strategic planning. That's an all-day event as well. And that's an in-person, and we want to see all board members there. Any other items that have come to mind in the meantime? Member Bodnar?
Thank you, Madam Chair. I too will be missing the May meeting. I'll be visiting relatives in Europe too. Not necessarily on the same flight as you, but
Are you part of the same family?
You make it to the family reunion and see some familiar faces, but
not that I'm aware of.
It's a smaller world than I thought it was.
I don't know, could we have 2 board members on the same plane, like the Coca-Cola syrup?
And both provincial appointees.
I was
That's a
gonna
bit
say,
of-
we may have to find different flights so that they don't travel together.
Okay, that's all the items I have. And then we will now go into closed session. So can I have a motion to enter into closed session at 10:25 to discuss an item 11.1 pursuant to a section 239 2B of the Municipal Act and 239 2D.
Before we go to closed session, I won't be at the next meeting either because I have a conflict with Grandbridge Energy. They're doing their AGM shareholders meeting. It's the same day. That I move, we go in camera.
I'm going there. I just RSVP'd this morning, so it's
We're down.
it's gonna be tight.
We don't have quorum. And it seems to be.
Okay, we will reevaluate. Do you have a comment? Dr. Jason or Sarah?
Yeah,
We'll look at a different date.
different day, yeah. Okay.
Thanks for the heads up on
It
that.
goes till 10:30. Try to make it work.
Oh, it goes till 10:30, so it could just be possible, like shifting the time.
Well, ish, because it's also paramedic service board that day, so
We will discuss and come back with other options. Okay.
Sounds like a heavy agenda.
If you do it after Maria gets back, I don't have to be in the chair.
The 23rd sounds good.
In a secondary.
I think that's a Saturday.
Oh, well, maybe not so.
Maria will be jet lagged, so.
See the mover and a secondary to go. into
For
closed.
the,
Yeah.
so can I have a mover and seconder? Member Martin, seconded by member Sicoli. Okay. Now that we're back in open session, can I have a motion to report and that staff proceed as directed in closed session? Member Bodnar, seconded by member Bell. All those in favor? Carried. And this concludes the meeting. Do I have a motion from anyone to adjourn? Member Martin. Seconder? Nobody wants to second that?
Just like
Member Michelle. All those in favor? Carried. And that's it for today.